So, from a preventative health perspective, from a burnout perspective, everything changed for me in March of 2020. We were in the beginning of the pandemic. We didn't know what we were walking into. We didn't know if we were going to be the next Italy. We didn't know if we were going to be the next New York. And it was scary. And there was a lot at stake, we felt. There was a lot that not only were our patients depending on us, but the community, the nation who was watching what's happening in ICUs. And this weighed heavily on us. And for the most part, we got through. We leaned on each other. We really leaned on our values, which was like compassion and being there for others. And we were able to get through some really trying times. But ultimately, there were times where it became more and more challenging. And I'll give a quick story. It was April 2021, and I'm with one of our respiratory therapists, and this is in the heights of I think it was alpha waves. So we're getting all these patients from Toronto. I'm sleeping in hospital now, like we're extra staff are on board. And I'm sitting there, we're standing in front of a patient's foot of the bed, and we're trying to decide whether to put them on a respirator or not, whether to go on a ventilator. And normally that's not a big deal, but at this stage of the pandemic, if the patient lands on a ventilator, they were going to be on the ventilator for at least 3 weeks. And remember, we're dealing with all these patients that are not from Ottawa, so they're away from their loved ones. It was just a really challenging time, and so there was a heavy decision. And so I'm standing next to our respiratory therapist, we'll call her Nancy, and she's one of our seasoned respiratory therapists. She's been around, she's stoic in nature only, and she starts crying as we're discussing this. And I was like, wow, Nancy, what's happening with you? And she was like, cordial, like, this is just, it's a lot, it's heavy. Like this is my 4th night in a row. I'm seeing these patients die alone. I'm seeing them away from their families. Like, this is so much. And this was knowing it was one of our stoic respiratory therapists, it was like this massive canary in the coal mine. We knew that if Nancy was struggling, a lot of us were struggling. And to be honest with you, this is when we saw a lot of healthcare providers leave the profession. And so that was, to me, the first sign that we need to do our best to kind of address burnout, have an approach to how we're going to deal with so many of our staff that have been struggling. The other component to this was our attempts to curb COVID, we had a lot of unintended consequences. We had people stuck at home, kids stuck at home. I don't know if any of you experienced, we called it the COVID-15 or the COVID-20, because you've been stuck at home, maybe having a pint or two and just not as active as you once were. And so there was that aspect of things where we saw a lot of unhealthy living really getting perpetuated. And the thing about COVID, and I rarely say this publicly, but I feel like this is a safe room, but in my, we'll say 3 or 4 years of taking care of COVID patients, I never once took care of a completely healthy person. It was all tied to either extreme age, or they had a compromised immune system, so immunocompromised, or it was tied to obesity or metabolic syndrome more specifically. So metabolic syndrome being pre-diabetic or diabetic, high blood pressure, obesity. And so this was a big aha moment for me as well, where I normally take care of the sickest of the sick. I'm used to that, and my area of research has always been on ways that you could save healthcare dollars and improve care. And then all of a sudden I'm thinking to myself, hey, if we get the population healthier, or if we focus on that preventative side, holy shit, everything changes. Like, instead of having people land in ICU where there's a ton of post-traumatic stress, anxiety, depression, ton of disability and lack of returning to function, And then the impact it's having on families too. Like if you have a loved one that's in ICU, you're not working. Like you're at their bedside scared to death. And so this to me was like a huge pivotal moment. It's like we need to really talk about how to get the population healthier.